This is just the beginning.
Hello, and thank you for joining this Axios virtual event. Welcome to my home in Arlington, Virginia. I'm right across the bridge from Georgetown. I can look out and see the Potomac. And thank you for joining us to talk about the hidden health crisis. We're going to dig into how the public and private sectors are coping in this moment, could cope in this moment, and we'll take a special look at mental health and Medicaid services. We'd like to thank Blue Cross Blue Shield for making this conversation possible. And to tee it up, we have one of my Axios colleagues, Caitlin Owens. She's a Tar Heel who writes Axios Vitals every morning, has been covering these issues for years. Now they're suddenly at the center of the national global conversation. Caitlin Owens, welcome to Axios.
Thanks for having me, Mike.
So, Caitlin, at Axios, we always start with the news, and today everyone is watching Wisconsin and the sort of live experiment that we have unfolding there after the state Supreme Court said to the governor, your stay-at-home order, your safer-at-home order, as they call it there, is invalid. Why does this Wisconsin experiment matter to our audience, Caitlin?
So, Mike, for those of you who don't know, Mike writes Axios AM, and this morning he wrote about this. And the most striking part is just looking at photos of people in Wisconsin who flocked to bars and restaurants and started socializing right after the order got struck down. So I think what we're watching in Wisconsin is to see if now that people are interacting with each other almost normally again in some places, what happens? Does the virus spread? Do we see an uptick in cases and hospitalizations in a few days? The public health experts certainly suggested that is, without stay-at-home orders, that is much more likely. And so it's going to be this interesting case study where, as Mike wrote this morning, some of the bigger cities in Wisconsin that are more heavily populated are still staying at home under local leadership and just more of an abundance of caution there. But in these other areas where people are mingling again, this is going to kind of provide this high-stakes experiment of what happens when we start interacting once again.
Now, Caitlin, our big topic today for our guests is the big trends in healthcare that have been exacerbated by the pandemic. And this is exactly in your wheelhouse. What have you been covering over the years that now has been exposed, laid bare for all to see and cope with?
I think that one huge implication of this pandemic is, in the US, what makes our insurance system unique isn't that it's private, it's that it's so inextricably tied to insurance. So one of the most alarming trends we're seeing here is as people get laid off of their jobs because these businesses can't operate in this environment, they also are losing access to health insurance in the middle of a global pandemic. And so that's obviously raised concerns about access to healthcare for people who do get sick with the coronavirus. And it's also just, I think, highlighted the underlying concerns about our healthcare system here in the US and whether people do actually have access to care. And, the answer is not everyone, obviously, but then the question really is, what do we do about that?
Thank you for setting the table for today's conversations. You and I will be back with a Why It Matters segment. Thank you, Caitlin Owens.
Thank you, Mike.
We'd like to thank Blue Cross Blue Shield for making these conversations possible. I caught up earlier with Congresswoman Lauren Underwood, who represents the western suburbs, exurbs of Chicago. She's the first woman, the first person of color, and the first millennial to represent her community. And on top of that, she's the youngest African-American woman ever in Congress. For today's conversation, at the top of her list is that she's a public health nurse, an RN, has taught nurses, and so this isn't an abstract crisis for her, it's very real. Congresswoman Underwood, thank you for joining Axios.
Well, thank you, Mike. So glad to be with you.
So we're anxious to hear, as you talk to your former students, as you talk to others on the front line of this crisis, what are you hearing from a nurse's point of view that we might not know?
Well, Illinois has been in a hot spot for cases for, the whole time that COVID's been in the United States. And so the issues that we were experiencing early on, sourcing PPE and making sure that all of our health providers knew that they were going to be well protected, are things that continue forward even right now, as the nucleus spreads, changes, and we have these hot spots in like nursing homes. We're hearing from a lot of healthcare workers who are still trying to source the masks and the gowns that they need, and really questioning when that kind of relief is going to come. And so we've been working really hard to try to make sure that everybody has, at the bare minimum, the protective equipment in order to make sure that they can do their job safely every day for their own health and for the health and well-being of their patients.
Congresswoman, as we talked today about the hidden health crisis, what has been exposed by this pandemic that was maybe there before, that was maybe clear to you, that wasn't as clear to others, the disparities in our system that you've seen up so close?
Well, we know that public health emergencies and disasters often exacerbate pre-existing healthcare and economic disparities. They shine a bright light on those disparities. And so in our state, this national conversation really got started because Illinois was collecting data based on race and ethnicity and then making it public. They are one of a small handful of states to do that. And so in mid-April, we learned that the city of Chicago, 70% of all deaths were to African Americans. Now, in our state, African Americans make up about 15% of the population. They are now a third of deaths due to COVID-19. In our state, Latinx communities represent, maybe they have a positive testing rate 3 to 5 times higher than any other population. They are 55% of the Latinx people who are getting COVID tests are testing positive. And so we're seeing disparities across several communities of color when it comes to COVID-19. And that's just in Illinois. We need to standardize the data collection across the country and make sure that it's being publicly reported so that we can track the disparities in cases, the disparities in deaths, and make sure that we are targeting all of our resources to those communities explicitly. The same way that we've seen a national effort to make sure that every nursing home resident can get a COVID-19 test. Why? Because we need to know if they're infected so that they can get into treatment. We need to marshal those same types of resources into communities of color, vulnerable communities, and medically underserved communities. And sometimes those 3 categories are different, but sometimes we're talking about the exact same places. We want to make sure they're getting the tests, they're getting the treatment, and they're getting the targeted public education campaigns that say, you too are at risk of contracting COVID-19, and here are all the ways that you can protect yourselves, your families, and your communities.
Congresswoman, when you got to Capitol Hill, you didn't wait your turn. You right away founded a caucus that's been paying attention to some of these issues. Tell us about the Maternal Health Caucus that you founded.
Yes. So with Congresswoman Alma Adams from North Carolina, we co-founded the Black Maternal Health Caucus in April of 2019 to tackle a long-term disparity where Black women have been found to be 3 to 4 times more likely to die as a result of childbirth in this country. It doesn't matter how much money you make, your education status, whether or not you had health care coverage or got prenatal care, where you live geographically, that disparity persists, and it has persisted for the last 30 years, my entire lifetime. And over the last 30 years, we've not seen a large national initiative, no Surgeon General's report, or any kind of large convening to tackle this disparity. And as a result, the United States has led the industrial world in maternal mortality. Over the last year, our caucus has grown to over 100 members. It's a bipartisan group. We're on the verge of passing the first Medicaid expansion since the ACA was passed in 2010, because Medicaid is the single best way to try to save moms' lives is extending Medicaid to a full year postpartum. It's called the Helping Moms Act. It's led by Congresswoman Robin Kelly. We're so excited about that legislation, and a comprehensive suite of bills. We're calling it the Momnibus, like omnibus, but for moms. And it was introduced at the beginning of March to tackle issues for veteran moms and incarcerated moms, to deal with these telehealth disparities and data collection issues, and to really make sure that we're having a diverse perinatal workforce so that all moms can choose the provider that they're most comfortable with for their delivery and postpartum care.
Very serious issues, but Congresswoman, our audience members who know the sausage making of Capitol Hill will really appreciate that name, Momnibus. What is the
That's
biggest? What's the biggest thing you think you've accomplished, or the biggest issue that you're anxious to call attention to with your Momnibus suite of issues?
Yes. So I would say the idea is that there are so many discrete issues that just haven't been put onto the agenda. And so we know that maternal mortality just hadn't quite found its time in the spotlight on Capitol Hill. Now that we have the attention of policymakers, broad support, and Senate partners who want to work with us, we're so excited that these bills have an opportunity to move through regular order in the committees. I think that we have the opportunity to take a comprehensive look at this problem, whether you're in a rural community that doesn't have a lot of healthcare providers. I represent a county that doesn't have a hospital. And so we know what it means to have shortages of providers and trying to make sure that they're getting the targeted telehealth resources that they need, or whether you're in an urban environment and you'd love to get a doula to be your advocate in a hospital that you may not trust can always listen or respond to the needs. We hear a lot about bias in our healthcare system, whether it's implicit bias, meaning the provider doesn't know that they're not listening and that doesn't quite realize that they're not taking the experience of their patient with the full weight that they would give another patient, whether that's because of income status or race or ethnicity. And sometimes it's explicit, right? Racism. But we know that there's bias in our system, and there's interventions that we can make at a federal level to train and to call it out and to save lives in the process. I am so excited, Mike, that solutions are on the horizon. We know that we can save lives and support moms and families through this process, so that we no longer have a maternal mortality crisis in the United States.
Congresswoman, we're about to get the hook, but I want to sneak in an audience question. We got a question from Chicago, and this reader said, in Chicago, on top of fearing for health and safety, many communities are facing a housing crisis that is exacerbating physical and mental health issues. What can Congress do about that? Or Congresswoman, is there any help that's on the way?
Yes, so housing is one of these social determinants of health. It could be transportation, housing, access to nutrition. We've heard about these food deserts. And so housing is a really important factor to folks' health and well-being. We think about people's hierarchy of needs, and the need for safe and secure shelter is one of the foundational things to a healthy life. And so I'm really thrilled that, for example, in the HEROES Act that we'll be voting on this week, we have an opportunity to support renters and mortgage holders that might be facing an economic crisis during this time of a pandemic, to make sure that they can stay in their homes, and then making sure that we have some longer term sustainable solutions so that people who may be feeling some economic instability do not worry that they will be entering into homelessness, because we know that there is a long tail when that happens. When people do not have safe and secure housing, they're more likely to have worse health outcomes, they're more likely to have poor nutrition status, and it's just disruptive to their ability to provide for themselves and their families. It's a very important question, and I know that many communities are struggling with it. It's not just Chicago, and working together, I think that we'll be able to have some sustainable solutions.
People who read my newsletters, Axios AM and PM, know that I love life lessons. And Congresswoman, as you were teaching future nurse practitioners through Georgetown, what was a life lesson, or what was a big thought that you tried to leave with nurses? What was the important, biggest big idea that you would leave with future nurses?
Yes, so for so long, nurses would say some version of, oh, I'm not political, I just take care of my patients, or that's a decision for someone else. We do not have the luxury of opting out of engaging in our political system right now. Literally everything that we do as nurses is informed by our policy process, whether it's the FDA approving a medication that we're able to give to our patients, or the rate that we're reimbursed for certain procedures. I mean, everything that we're doing is influenced by a policy process. And if we're not informing it, then we're not only letting down our colleagues, we're letting down our patients and our communities. And so I encourage them to just get involved. During the time of a global pandemic, any policymaker that doesn't take a call from a nurse, shame on them. Shame on them. And so I've been encouraging all the nurses that I talk to during this time to continue to reach out, continue to share their stories for everybody that they can, whether it's a local mayor or county level official, their health department, all the way up to the senators and the president of the United States. We know that nurses are on the front lines of this crisis and need to be able to inform our policymakers about the current status of our healthcare system, the conditions of their patients, and the circumstances under which they're working during this extremely challenging time.
And as we say goodbye, these are sobering issues, but we like to end with a smile. And when you're in Congress, when you're running for Congress, you get interviewed by everyone under the sun, as my mother would say, but you are the rare member of Congress who's been interviewed by Bon Appetit. Congresswoman, tell us one tip you gave Bon Appetit.
Well, I love to cook. I love to bake. Just yesterday, I made this new rhubarb cake, a rhubarb custard cake from Bon Appetit. It's like a coffee cake, but it gets the rhubarb gets real jammy. It's delicious. Rhubarb is in season right now, which means two things. It's fresh and delicious, and it's cheap. So I would encourage everyone to go and find that beautiful seasonal produce, support your local farmers, and go and make something delicious this weekend.
Fantastic advice. Congresswoman Underwood, thank you for joining Axios.
Thank you, Mike. It's been a treat.
And now we're going to go across town and we're going to join Jim Vandehei, CEO of Axios.
Thank you, Mike. I love your excitement when you say Bon Appetit. We're doing a view from the top. We have David Holmberg, who is president and CEO of Highmark Health, which is one of 36 Blue Cross Blue Shield companies. Welcome, David. And tell us what your company does, how it's different from others.
Hello.
Hello. Tell us about Highmark Health. And
we have no sound.
And what Apparently, we're having technical difficulties.
We still have no sound.
We'll go back to Mike Allen while we work out the sound issue here. Hey, Mikey, I think they're working on Hi, Mikey. They're working on a technical issue with the sound with David Holmberg, so you get to chat with me.
We still have no sound.
So, Jim, I'll just pick up the ball. I know that David Holmberg has been spending 70% of his time on COVID, and something that we learned from him is he has family members on the front line. And Jim, this is something that I find, whether it was just talking to Congresswoman Underwood, whether it's talking to healthcare experts, whether it's talking to our colleagues at Axios, almost everyone is being touched personally by this. There's nothing abstract about this crisis.
They're not, and I think what David's company does is interesting because they're both they're one of the rare companies where you have a mixture of both being a hospital and an insurer, and so they have amazing access to sort of the early warning systems of what's happening in the healthcare systems. And I think it's one of the neat things that Caitlin does with her gig, and what you're able to do is to hear from people in real time and kind of separate what you hear in the political sphere from the president or others who might have a political agenda versus what's just really happening. And you talk to these hospitals, and one, they were aware of it early on. They started to see what was happening in China in December. They're starting to pick it up because their health systems see it. They see an uptick in the type of patients that are coming in and then having to respond to it. Hopefully we'll get David back if we do. I did a call with him the other day, and he was talking about how they were able to identify early on a cluster in Pittsburgh because they were able to pinpoint a few people in one church that had it, figure out where they got it from, and make sure that they could contact everyone who had been in contact with them. And when you hear and you talk to whether it's Dr. Fauci or other people, like that's what we're going to need to do, right? When you do figure out if those people in Wisconsin go into a bar, and if God forbid one person does get sick, we're going to have to track down who else was in that bar, who else were those people in contact with. That's really the only way that you're able to stop the spread, and then get the frontline health workers involved in finding them, helping them, getting them the right medicine, getting them the right tests, and make sure that then people do what they need to do based on what the professionals are telling you.
Yeah, and Jim, something I was struck by is reading a note from David Holmberg, the president and CEO of Highmark Health. And as you mentioned, back in December, they were preparing for a mass casualty event. It makes me wonder if Highmark Health was preparing for a mass casualty event, why so much of our government seemed to have been caught flat-footed.
Yeah, I think that will be continues to be sort of the big question mark, and one that will be explored for the rest of the year. Not just because of part of the blame game, and that's always a part of politics, but also to figure out like what are the things we got right and what are the things that we got wrong for the next time that there's a pandemic. If you hear from Bill Gates, you talk to anybody who's studied this topic, they kind of knew it was coming. Maybe not this specific year, this specific strand, but at some point we were going to get hit by a pandemic. And you talk to those people, and they say it's going to happen again. And so the question is, do we learn a lot from this episode to make sure that the next time it happens that our system's prepared, that our government's prepared, that our businesses are prepared, that we have a playbook that you dust off and you just roll into so that you can limit the amount of contagion, that you can limit the amount of deaths that come from a pandemic like this.
Thank you, Jim Vandehei. Appreciate it very much. And our next guest, who's one of the most influential voices in healthcare, period, is a great window into some of the issues that Jim Vandehei just mentioned there. Andy Slavitt, who ran the Center for Medicare and Medicaid Services, CMS, under President Obama, is a Harvard MBA, was a McKinsey consultant, was a Goldman Sachs investment banker, and was a healthcare founder and CEO. Andy, welcome to Axios.
Thanks for having me, Mike.
Andy, all of our guests, all our audience has seen your name, seen your thoughts so often, and now you have your newest hat. You're host of the In the Bubble podcast. What's it been like to be on the other side of the microphone with your In the Bubble podcast?
So the truth is that this is 50% of the podcast is an excuse to do something with my 18-year-old son, who is clearly has limited choices. He's graduating high school. He's stuck at home with his mom and dad. And he agreed to do this podcast with me. You know, as you might imagine, if you get your 18-year-old to agree to do anything with you, you're winning. So we decided to launch this podcast together really for, he was basically sitting around listening to me talk to governors and well-known people and senators, and because I'm someone who has the privilege to have my phone calls returned, he's like, Dad, why don't you just have those conversations like on a podcast so people can hear what's actually going on? And we kind of look at it as we describe it as 50% Winston Churchill, 50% Fred Rogers. So kind of hopefully a helpful, unifying conversation for the whole family that hopefully is helpful and not just sort of news by Chiron.
Very neat. Well, it sounds like you have another founder in the family. And Andy, nobody knows both the wiring and the big mission of Medicaid services better than you. And our big idea today that we're unpacking for our audience is hidden health crises that are being exposed and exacerbated by this pandemic. And what would you say is one of the most urgent issues facing Medicaid that's even more starkly shown now that we're in this healthcare crisis?
Well, look, I like to oversimplify for effect, and in my parlance, we have two types of people that access healthcare. We have the Peloton crowd, and we have the take the bus crowd. So we've got plenty of people in this country who are seeking to be healthier and healthier, access resources wherever available, guide themselves to whatever, can get rides wherever we need to go, and we tend to win. But as Congresswoman Underwood said, there's a large number of people, like 130 million people, that who, for one reason or another, the healthcare system that's even challenging for us to navigate is almost inaccessible for the needs that these folks have. and we have to do a better and better job bringing care to them. And it's care writ broadly. It's mental health. It's the social services to keep them healthy. It's increasingly going to be immunizations and preventive medicine. And in this particular time, we are finding that the people who are most at risk historically have an exclamation mark on top of it. If you can't be taken care of at home any longer, and you're in a nursing home or other congregate care setting, you're massively exposed. If you're part of the criminal justice system or a foster care system, you're exposed. If you live in public housing, you're more broadly exposed. And we have not a great track record in this country of caring equally about the lives lost. If we just compare it's a little simplistic comparison. If you compare the crack epidemic to the opioid epidemic, where one felt like it was happening to other people, and we were able to kind of more neatly criminalize it, versus the opioid epidemic, which everybody felt like has been happening to us. And I'm not suggesting we've responded perfectly well to it, but we've responded with a lot more empathy in the policy regards. I really hope that that in the pandemic, we all realize that we are connected into this together, that the person sitting next to you on a plane or on a bus, if they aren't able to take care of themselves, it affects you as much as it affects them.
And Andy, you mentioned mental health. And as we think past this immediate pandemic, as you think to future waves or the aftermath of the pandemic, what do you think is going to be the biggest need from both the private sector and from government in responding to increased mental health needs?
Yeah, I mean, there are some data out already on, what we all talk about as deaths of despair, addiction, alcoholism, drug addiction. And, I'm in contact with a number of clinics who are on the ground serving people with addiction challenges. And there's some pretty good evidence that says that exposure to what they call sustained trauma, in other words, trauma that is not a kind of a one-time event, but a day in, day out level of trauma, has really significant kind of PTSD-like impacts. And many people choose to self-medicate, but those that don't find themselves lost. Start with the medical community. Start with people who are going in every day without the help and protection that our frontline workforce should have, and exposing themselves to this, watching people die alone. And it's an experience that they can really share with others very well. And our social support system is down. Move to the fact that we've got so many people, a third of people apparently not able to pay the rent in April, 40 million people hungry. And it's one thing to sacrifice. It's another thing to sacrifice when you don't have your social support system there for you, like it was during World War II, where at least, we had each other. So I think there's going to be, the need is going to be dramatic. I think we always in this country have we've underplayed and underinvested in that particular need, and this is a wonderful opportunity, given the shared experience that we're all going through, to really, right now, help each other. What I like to say is, if you need help, ask for it. If you're going to have a particular day where you don't need help because these things come in waves, try to help somebody else. And it's incredible how self-fulfilling that can be. And then over the long term, we've got to pay attention to this, as you said, Mike.
And Andy, my last question for you. You tweeted that attacks on Dr. Anthony Fauci are actually dangerous. What did you mean by that?
Well, a couple things. First of all, I like many people, want our best players on the front line working on these issues. And Dr. Fauci is, I think, an integral player in helping us get a vaccine, not just because of his scientific work, but because of his relationships and his political capital, his ability to pull people together to get things done. You do not want to take him off the front lines. But I also need something different, which is this sort of suppressing of this inconvenient scientific voice. It's happened with climate scientists. It's happened with the entire EPA. It's happened in other parts of our of our system. And look, I'm trying to keep these away from being strictly political comments, but I think if the president feels like pointy-headed scientists are getting in the way of what he believes to be the right agenda, economically, politically, what have you, and I'm not even making a judgment as to whether or not everything Dr. Fauci says is correct. I don't think he holds himself out as that. He holds himself out as someone who gives the best scientific advice he can. And whether it's listened to or not, it needs to be considered. And belittling him basically just keeps us on a track to saying that expertise doesn't matter. It puts us on a track to continue to silence people and to surround our decision makers only with people who will nod their heads in agreement, or at best maybe try to work around something they don't agree with. And it's really not a great way for us to be focusing on this crisis. And I'm distressed that there aren't enough people speaking up for Dr. Fauci, who know his long track record of being with us on our side for every major threat that we've had over the last, since the 80s. And I find it disappointing. I loved what Liz Cheney tweeted, if those who didn't see this, in support of Dr. Fauci. But I would expect people from all over the country, from all political equations, to be standing up for him, not in a way that challenges Trump, because I don't think that's the idea, but just in a way that doesn't watch this happen in front of our eyes.
Andy Slavitt, we're going to follow your conversations on your Family Affair podcast, In the Bubble, and thank you for joining Axios.
Thank you, Mike.
And now we're going to head across the parkway to Axios CEO Jim Vandehei.
I think we've built up enough suspense. I think we really have David Holmberg, President and CEO of Highmark Health. David, can we hear you, see you?
Absolutely. I'm glad to be here with you. This is all about adapting.
I love it. We had a great conversation the other day. Explain to viewers who might not be familiar with your company what your company does.
So Highmark Health is the fourth largest Blue Cross Blue Shield plan in the country. Covers most of Pennsylvania, West Virginia, Delaware. And then also, we have a health system. So we have 10 hospitals, thousands of physicians, but very much an integrated approach to healthcare. And so has national reach and a very local focus.
You have amazing access to data. You told me that starting in December, you were watching what was happening in overseas and preparing for the effect that it would have here. When did your data start to show you that we have a problem here in America, that we have a problem in areas where you have a presence?
Well, first of all, not only being an insurer and a provider of healthcare, we knew that we would be the front line of defense, if this were to come to America. And so we were watching closely all the way back to December what was happening in China. And when we saw the early cases start to emerge, it was very clear that it was not in control. And then as cases developed in Europe and then ultimately patient zero in New Rochelle, New York, we realized that we needed to stand up our pandemic operations center, and that's actually where I'm at today. It's designed to give us as much information as possible, both from the Blue Cross Blue Shield side, but also from the frontline caregivers to be able to look for the early indicators, and we started to see the early indicators.
What is the data that you're looking at today? You said you're in the pandemic center. Like, what is the data telling you? Like, what do you know based on the insight that you have that would be helpful to viewers?
Well, first of all, we broke this whole strategy in dealing with the pandemic into three different buckets. The first was defend, and we took it very seriously that everything that we do was about protecting our members, our patients, our communities at large, and making sure that what happened elsewhere around the world didn't happen here. And so, we can see all the data that tells us what's happening in our emergency rooms, hospital beds, as well as clinical data across the entire region. And what that's done is given us an opportunity to see early indicators of hotspots and what was happening, and then react before they got away from us. Best example we have is that very early in this, we identified the first 2 cases of COVID-19 in Pittsburgh. And we were able, between our clinicians and our data scientists on the Highmark Blue Cross Blue Shield side, we were able to narrow it down to an individual church and then inform the Department of Health, work with their teams, and find solutions to be able to nip this in the bud before it got away from everybody. And I think that's probably the perfect example of how we can do this, and how important it is to have partnerships when you're fighting a fight like this.
Well, there's a vigorous debate going on, obviously, about when people can return to some semblance of normality. One of the, I think, pleasant surprises is early on we thought there'd be a massive shortage across the country of open hospital rooms, open beds, equipment that people would need. Are you surprised that we haven't seen a bigger problem, or one the size that we once anticipated we might see? And should that give us comfort, or should we still be worried?
Well, I think first of all, there are many parts of the country that were able to learn from the pain that New York felt that happened in Italy and elsewhere around the world, and even what we saw in Seattle and other places. And so we had a little bit of a head start, and we were able to set up perimeter defenses, social distance, maybe a little bit earlier than others had a chance to take actions to prepare. I mean, we actually took 18,000 clinicians and stood them down from what their day-to-day work was, repivoted them into this fight, and prepared them so that we had the beds ready, we had the clinicians prepared, and we were able to absorb whatever came our way. Fortunately, we've had a lot of success in this part of the country, and at the same time, we recognize that there's a lot of risk ahead of us, because we've been able to slow down the transmission of the disease, and we've been able to manage the number of patients that we've seen. And consequently, we've got to find a way to keep that at a steady pace, so that as more people get together and as we get back to work, which is critically important, that we do it in a common sense, responsible way. And then that way you don't overwhelm the healthcare system or put people at risk.
How hard has it been to keep the people working for you healthy? You're obviously in a healthcare environment. Probably a lot of your people are exposed to people who are exposed. What has that meant for the company? Has there been a lot of sickness? Have there been a lot of illness? Have you suffered death?
Well, we've been very fortunate. I would say that one of the principles that we landed on very early on was not only would we defend this region, we would protect our frontline caregivers, and we would do whatever it took, use every resource, every tool we had in order to take care of our customers and our patients, but also our own people. And so what that meant was very early on, we saw disruption in the supply chains, just like everybody else. And consequently, we adopted a strategy of self-rescue. So we took Blue Cross Blue Shield clients that we had who were in the manufacturing space. We took our best scientists, we asked everybody to join us in this fight, and we created new and innovative ways to create personal protection equipment and fill some of the gaps that others may not have been able to do. My best example of that is this device right here, which is called a P100. And essentially, there's a company called MSA based here in Pennsylvania that makes this for firemen and for industrial uses. Their scientists, our doctors came together, and we were able to adapt it and change it into the healthcare mode. And so by doing that, it literally, each one was worth hundreds of N95 masks that you see and you've heard about. And what this has done for us is given our teams armor, so that when they were on the front lines taking care of individual patients, they felt the confidence and had the safety that they needed to do the right things.
Thank you, David. Thank you for this conversation. Thank you to Highmark Health and to Blue Cross Blue Shield for making this conversation possible. Stay safe and stay healthy. For the viewers at home, I'm going to toss it over to Caitlin, author of Vitals, for us to sort of sum up what she's seeing. If you don't get her newsletter, you should. Very thoughtful reporter, thinks a lot about the trends that are affecting every aspect of our healthcare system and of our lives. So over to you, Caitlin.
Thanks, Jim. And just I was reflecting as we've been talking, and Jim just mentioned the trends that I cover in my Vitals newsletter. I just want to point out that this coronavirus pandemic, it didn't create new problems. It took hold of the existing problems with our healthcare system and with our society writ large, and it kind of made them explode. And so part of what I'm talking about, look, the American healthcare system is the most expensive in the world, and yet we don't have better health outcomes to show for it. And in America, how much money you have has a lot to do with the kind of healthcare that you have access to. And so, traditionally, the losers of our healthcare system have been low-income people, minorities, and people with chronic or pre-existing conditions. When you look at this coronavirus pandemic and how it's playing out in the U.S., who are the groups that are losing? Low-income people, minorities, and people with chronic health conditions. When you look at the statistics, they're the ones that are getting sick disproportionately. And as we all know at this point, people with pre-existing conditions are more vulnerable to the coronavirus if they do get it. And so I think that it's just food for thought as we go forward. Eventually, this pandemic will end, but it hasn't created new problems. It's exacerbated existing ones, and I think we'll all have to grapple with how to address that going forward. So thank you for everyone who tuned in. We really appreciate it, and stay safe, please.